our belief is that things occur for a reason, and the reason they occur is locked in some initial sensitizing event.
Right.
An event that occurs at some time in that person's past, which has caused a link to be made in the subconscious mind to a particular emotional, behavioural or physiological response. And in this instance, the closing of the throat and the restriction of breathing in the presence of eggs. Somehow the subconscious mind has linked those two. That's our hypothesis. And if we can get back to the first time when that link was formed and shatter that link, then the response just goes away.
Right.
And so this is a little bit different, I think, from when you're talking about antibodies, because to my knowledge, no antibodies are being developed here. Mm-hmm. This is just a pure physiological response in response to this food substance, in this instance, eggs. Mm. And this is the case for a lot of people that suffer with various allergic responses. And so we regressed, and as you viewers that watch this may know, the nature of the regression is we stimulate certain feelings, emotions and sensations connected with the feelings. And of course, if he's experiencing restrictions of the throat and breathing, there's tremendous fear there, as there would be for any of us.
Yes.
And so deliberately, which may sound surprising at first, but I stimulate that emotion and use that emotion to link back to the first time seen and place connected with it.
Right, because the language of the subconscious, which is where we're working to get to the initial event, is feelings, emotions, sensations.
Correct.
And what we do is you stimulate it here because that is the only way you can follow that
Right.
feeling down
Right.
until you get to the actual physical event that occurred.
Right. Exactly. And
Right.
again, we don't stimulate things to make things uncomfortable for our clients. It's not we're trying to stimulate a cathartic response. We're trying to form a link.
Right.
We're trying to find out, where does this start? So what we got back to the initial event, as far as I could identify it, was when he was young enough that I don't even think he was walking, because it occurred when he's in a high chair.
Okay.
So hard to identify the exact age, but probably somewhere around about 7 months, 8 months, maybe a bit older. And again, for those of you that haven't watched this may seem really, really surprising that we can get back to an event that early.
Right.
Again, this is not something that he consciously remembered.
Nope.
It's locked in the subconscious mind, and that's part of the problem, because it's subconscious, we don't know. And the only tool that I know of that can reliably get us there is this deep hypnosis.
Right.
That's why we use it.
Right.
So we get to that place, and the event is that he's sitting at the table and it's breakfast. His siblings are around, and his mother and father are arguing about something, quite a volume. There's shouting going on, not at him. He's not the person who's the subject of this,
Right.
but he's scared by it.
Right.
And he's got an emotional response, because it's disturbing for little kids when adults argue, particularly if it's mum and dad, and the volume of noise is going up. And he's eating an egg. And it turns out that, as far as I can identify, this egg was perhaps a little bit overcooked, and it was quite hard. So it was hard for him to swallow it.
Right.
And he was having difficulty swallowing this egg, and in a moment of exasperation, his mother turns to him and said, "You've got to eat that, you've got to finish that and eat that egg." And she's upset, and the father's upset, and he's trying to eat this egg, and it's kind of sort of sticking in his throat, but he manages to eat it.
Right.
But he's very, very upset.
Right.
Well, this seemed to be the emotion, the upset and the trauma, and this is what we cleared. Now again, that won't seem like to most people a big trauma.
Right.
But what happened is that every time his system sees and detects eggs in any form, it compounds that response.
And the thing is that to kind of put a point on that one is, he's got the emotion
Right.
from his parents arguing,
Right.
and he actually has a physical feeling of
Right.
that thing sticking in his throat,
Right.
and it can feel like, geez, it's closing off,
Right.
right, and it feels like that at the time.
Absolutely.
So the emotion and the physical sensation get linked.
Right, and so here's the mistake, as it were, in the subconscious mind. The subconscious mind says, "Oh, eggs make me choke."
Right.
Right? And eggs, strong emotions, right? It links them, it creates a link, it bonds them together.
Right.
And it says, better avoid those, right? And here's how I'm going to let you know that there's a real problem. Anytime you have something like that, you're going to start to choke or feel the feeling of choking. That's its warning system.
Right.
Right?
Right.
It's telling you, whoa, big problem. Right?
And the thing is, remember too, this might sound fantastical to someone who hasn't been involved in hypnosis and so forth, but they're not logical links.
No.
Basically, it is whatever occurs
Right.
is occurring in the scene at
Right.
the time.
Right.
Just like if you you may smell a smell coming
Right.
out of a kitchen,
Right.
and all of a sudden you smell it, and your mind goes back to a certain scene.
Yes.
That it was that you had the same smell when you were
Yeah,
earlier. So there is a link.
Absolutely.
there.
In a sidebar, just a sidebar this, and I mentioned this on the show. For years and years, whenever I used to smell chlorine, bleach, or anything like that, I used to feel very, very, very nervous.
Right.
And I didn't know why this was at all. And then I realised it went back to swimming lessons
Yeah.
when I was very young. When I was a child in England, we had swimming lessons and the water was cold and I was always seemed to be just above where I could breathe and I was standing on tiptoe and I couldn't.
Right.
And there was a lot of stress associated with this. And of course, what's the big smell that you smell when you, at least then when you approach a swimming pool? The smell of chlorine bleach as they
Right.
clean out the changing rooms and so my mind associated those two, and I would always wonder, why do I feel nervous when I smell chlorine bleach? And it was the subconscious mind has made these links.
That's it. And think about, if you think about that, it was exactly what we were just talking about. You have the emotion at the time and something physical, a smell.
Right.
Okay. Well, chlorine, there's no logical link between I'm nervous and that smell,
Chlorine, right.
but they occurred at the same time for you.
Right, and it's telling myself, oh my, you're going to experience an unpleasant situation. This is going to be very bad. You want to try and avoid this. Now, in my instance, it didn't make me phobic of swimming. I like swimming, and it didn't make me stop visiting pools. But it was like, boy, I'd feel nervous every time I'd smell it.
And it's trying to, your subconscious is trying to protect you by that
Right.
because at the time, whether it's not true that you're in danger, but you felt nervous and you're worried about it. And so it's trying to protect you when it smells that, oh, there's danger around.
Right, so let's come back to our little boy. So what happened? So we got there. We go through a process which we've described on other shows and we'll describe again, but basically we go through emotional clearance. There are feelings, emotions and sensations trapped in that event. We clear them, we have a process for doing that. And as we cleared those emotions, he seemed to be fine. We went through the events a few times. So we end the hypnosis session, and of course his parents naturally asked what happened, and I said he did very well. And they said, well, what do you think? And I said, well, he doesn't, I don't believe he'll have this response or reaction at all. And they were incredulous. Well, how do you know? And I said, how will we know? And I said, well, I'm sorry, the only way I know of knowing is he has to try some eggs. And they were very, very scared of doing that, understandably.
Right.
And so literally, they were brave enough, and more importantly, he was brave enough to try this. But they had the hospital on alert, they had the doctors there, they were ready literally to cart him off to hospital. So it took a great deal of bravery on their part.
Right.
And
But those precautions are really important.
Yeah.
Because we would never tell somebody, oh, just go start eating the eggs.
Right. And I said, so, so here's what they did. He took a small piece of an egg, no response. He took a bigger piece of an egg, no response. I was in that area of the country, I was working in a different part of the country, and in the 4 days he ate boiled eggs, scrambled eggs, fried eggs, omelettes, eggs in any form that you can possibly think of without any of the responses that he previously had, because he actually enjoyed eggs. He liked eggs. And he was very happy that he could eat eggs. But here's the thing that occurred, which was somewhat disturbing to me. So I said to them, because he had other allergies, can we now work on some of the other things? And they said, well, they weren't sure. And I said, okay, we'll think about it. I contacted them about 2 or 3 weeks later, and I said, how's he doing? He's doing fine. I said, is he eating eggs? Oh, no. And I was like, and I said, why? And they said, because it might come back. Now, I don't know if they've been told that or they thought about that. But what was apparent to me was that they clearly didn't understand the basis upon which we worked. And so where this little boy was not showing any adverse symptomology, just in case it might come back, it might come back. So that really tells me that they didn't really believe in anything that we'd done in getting to the cause. I don't know what their explanation was for why all of a sudden he couldn't eat eggs and now he could, what their alternative was.
Yeah, like how could they explain it other than that? Now let me ask you this.
Yeah.
Did you find out, did the boy want to eat the eggs?
Absolutely.
Okay.
He was very, very sad that his parents were preventing him from doing so.
Yeah.
And he was quite distressed about it, actually, because he really liked eggs. And
right,
he wanted to eat them, and his friends ate eggs, and his family ate eggs, and if It's in America, breakfast is very often eggs, in some shape or form. And so this created problems for him when he travelled, when he visited people, when he was with his family. But and I must confess, I'd followed up a couple of times, but they were scared.
It's funny because a smaller, how old was he?
12.
12. A small child, actually saw the treatment and the effect and went, it worked.
Right.
And he was okay with it. And he was the one that was gonna be affected directly by a very severe thing, and yet the parents couldn't see that.
Yes, and it was. I must admit, I was quite distressed by it because he had many other allergies, and again, this is something I wanted to say, and I wanted to really state on the record. We are not saying that every single allergy that everybody has can always be affected by a hypnotic process.
Right.
That's not a reasonable claim for us to make. What we will say is that we believe strongly that many can be and respond favourably. And of all the potential treatments that you can use and have, by comparison, hypnosis is so harmless because there are no side effects.
Right.
So we're either going to find we're going to be effective or we're not going to be effective.
Right.
When people come to us, it tends to be because they are in a very, very severe condition, or they've tried all sorts of things and either they partially work, temporarily work, or don't work at all.
Right.
And as Bill has pointed out from a scientific viewpoint, sometimes that's almost self-selecting. We tend to get the cases where other things haven't worked, and so perhaps there's a high likelihood that what we do is going to work.
And that's why we have to be very careful about the assumptions we come up with based upon what we see.
Yes.
So for instance, if someone has something that is really caused physiologically, has nothing to do with the mind making it worse or causing it or anything like that, then some of these Western interventions, and I'm a Western medicine guy myself, right? Western interventions are going to work and we won't even see them.
Right.
But what can happen is if there really is being driven a lot by the mind, well, they'll try these typical interventions and they won't work. And so they've tried this and this and this, and then they come to us. And so we might see a higher percentage of cases that we can cure or treat successfully because they're being selected out, the ones that truly aren't a physical problem.
Right, but where it can be helpful, it can be very dramatic. And again, I'm going to turn to an example, if I may, of one of our mentor and teacher and friend who sadly passed away a while ago, Stephen Parkhill.
Right.
Perhaps the most dramatic example I know is where Stephen Parkhill went to visit a lady who was very, very seriously affected by various environmental allergies. He described it very graphically one time to me, where he said that he went to the door, he knocked on the door because she couldn't leave the house, and he heard a kind of any sound. He didn't know what it was, and he realised afterwards that they had duct taped or put tape on the door. They were untaping it. Wow. And as soon as they'd opened the door, closed the door, taped it back up, and she had to go into. He said it looked like a perspex coffin standing upright. She went inside and she was flooded. I don't know if it was with oxygen or air, because just that could cause her to go into a problem. And not only was she had problems with the environment, she was down to only about 3 foods that she could eat. It was very, very limited. So why was Parkhill called? Well, quite simply, they were absolutely desperate. They didn't know what to do, and it wasn't getting better, it was getting worse.
Right.
Now, it was a very dramatic case because I think he only worked with her a few times, but he said after one session, she said, I fancy a steak. They opened the door, no problem. They went down to a restaurant with a smoky atmosphere, which normally would have been a problem. That was in the days where you could smoke in restaurants. He said she tucked into a dip that was
tucked in. It's your British terms.
I'm sorry. She tried. She ate a dip.
Okay, go ahead.
I think it was a salsa or something. He said that it was so spicy that it gave him heartburn, and she polished off a steak which she couldn't eat, potatoes, vegetables.
Yeah.
So her allergic response dramatically and utterly changed. And in her instance, and in the instance of other people suffering from similar things, it's a life-changing experience. Mm-hmm. She was literally, she couldn't leave the home. She could only eat very, very limited foods. She had awful, life-threatening responses, and it was utterly changed.
Right.
Through this process. Very dramatic example.
Right. And one thing and this is more of a technical thing, and
yes.
is that people can have there are allergic responses.
Yes.
Allergic responses is a very specific thing.
Yes.
And, it causes hives and, it can constrict
Yes,
the throat and
yes.
things like that. A lot of people will say, I'm allergic to this because it upsets my stomach.
Yes, yes.
That's not really an allergy.
True.
It's an
Very true.
Reaction reaction to
Very
it.
true.
Okay.
Yes.
But honestly, even in that case, it could still be that we can we can reduce it or whatever through the use of hypnosis, because it could be the same thing.
Well, when we talk
was
about,
linked.
we're going to have a program in which we're going to talk exclusively about IBS, irritable bowel syndrome, in which these things occur in relation to digestive disorders.
Right.
That's for a different time. But the basic premise is correct. Absolutely.
Right.
Yeah.
Right. Exactly. So, and if you think about, well, is this just an isolated thing?
Yes.
Well, Dave Ellman, what he did is he went and did so many of
Yes.
these cases of seasonal allergies, and what he found was he always got back to an initial event, and once he relieved that, they went away, and
Right.
it happened time after time after time.
Yes, and again, this is one of the good things about, we mentioned Dave Ellman a lot because not only was he a great hypnosis practitioner, but also he was teaching doctors. And because he was teaching doctors, sometimes, he literally taught thousands of doctors. He would sometimes ask the doctors, go and try this, and he would have 200-300 doctors all at the same time trying something. So what that meant is that there was a great deal of anecdotal case history on certain methodologies, and he found that an enormous number of allergic responses, allergies, could be relieved through these processes. You wanted to read something there.
Right. Because it's what he says in a lot of cases is that the allergies have always been present by different tests and so forth.
Yes.
But for some reason they did not show symptoms, and he's always found that that there's something, and it's usually an emotional event triggers it. So
Yeah.
all of a sudden, you get the symptoms.
Yeah.
But like you said too, it's really important to understand. He was teaching thousands of doctors. He would have to do demonstrations in some
Right.
of these things. He couldn't tell these doctors something that wasn't really the case,
Yeah.
because he would demonstrate it, and like you'd say, if he wasn't sure, he'd have doctors go and try it,
Yeah.
hundreds,
So here's
and come back to the next session and
So here's an example, just to read. He said this is one where somebody developed hives, and it seemed to be connected with her response. Was it her response or his response to the boss? So it said to find out, and I'm just going to read this, folks, to find out whether the reaction was strictly emotional, the dermatologist, so it's a dermatologist doing this, pretended to be the boss during part of the hypnoanalysis. After listening to the doctor give orders for 2 or 3 minutes, the patient developed enormous hives on his arms, legs and body. These hives were larger than silver dollars. When we told the patient the boss had left, almost immediately the hives disappeared. And he puts in a short paragraph, we have worked with several victims of hives, and the symptoms always seem to originate on an emotional basis. While hives may or may not be considered an allergy, they do show an emotional reaction similar to allergic reactions.
and you think about that. Your body can create so many different things. Physical.
Yes.
If you're embarrassed, it can dilate your blood vessels in your head so that you
blush.
get red.
Right.
You blush.
Right.
You may start sweating
Right.
all over,
Right.
because if you're nervous. So it is making physiological changes in your body.
And so let's talk about this in hypnosis as well. One of the things that hypnosis practitioners have identified, and this was way before us, this was identified by, I believe, Bernheim and Leopold, acting at, when they were working from the Nancy School in France at the end of the last century, in the late 1800s.
It almost sounded like you said Nazi. Let me make sure.
Sorry, Nancy.
Nancy.
Nancy,
Nancy
right?
is pronounced
Nancy,
Right.
in France. Not Nazi,
Yeah.
it's Nancy,
Yeah.
right, in France.
Right.
And 2 doctors, very serious people, what they found is that they could produce allergic reactions through post-hypnotic suggestion.
Right.
They could create an allergic
Right.
reaction. And this fascinated them naturally, because if you can create it, maybe it can be taken away in the same way.
Right.
And that's exactly what they discovered.
Right.
So this is the strange thing. We can create it. And that's an example of where the observation was by a dermatologist, somebody whose whole profession is based upon the treatment of skin and understanding of what happens to the skin. He observes this as a result in hypnoanalysis, and by that Dave Elmer means in deep hypnosis whilst they're trying to discover the cause of something, that they develop the hives when he took on the character of the manner of the boss.
Right.
And it went away when the boss left.
It isn't, and that's just seems so odd, but these are doctors sitting around watching this.
And the body, and so what's happening there? Well, the subconscious mind is giving a physical, saying, look, get out of this situation. See, this is really bad. And if you don't get out, I'm going to create something in your body to get you out of there, right? To warn you. It's literally giving a physical warning.
Right.
And if we look at the subconscious mind as the protective mechanism that it is, then we understand why these warnings are given, and then we can work with it.
Right.
Of course, that person may want us to change their jobs or change their boss as well.
I've had a couple of those too myself, But and the funny part is, he sees these allergies that come and go, with hypnotherapy, and the thing is, in the end, he says, well, the allergy isn't really gone, but the symptoms are gone.
Right.
So he says, well, I haven't cured the allergy.
Yes.
You still got antibiotics, but it's no longer creating a problem.
Right. And again, we would say, and we're looking at it from some slightly different models, under the Dave Elman's model, he's saying, well, he's changed the response, but the antibodies are still there in the case of hay fever or other things.
Right.
We are saying something a little bit different for some of these things. We are saying that there is an emotional cause. There is emotions trapped in the structure, in the organism, connected with particular events. When we release those, when we change those, after following the emotional release, there is a change in perception of that event, then all subsequent responses seen by the subconscious mind to similar stimuli end.
Right.
They end at that point.
Right.
So from our perspective, from our model, we've got to the cause of things.
Right.
Now, is that model the absolute truth? I don't know.
Right.
Right? It's a model. Is the other model the absolute truth? We don't know. Does it produce changes? Yes.
Right.
Right?
Right.
Does it produce any harm? No. So what we have is a very harmless process which can produce very, very profound changes. And that to me seems like almost the medical ideal. We first do no harm and we create wonderful, potentially wonderful changes. Are we successful 100% of the time with everything? No. But we are very frequently successful given certain conditions.
The nice thing about it is the worst case is we can't help them.
Right.
That's it.
Right.
It's not like you're going to have an adverse reaction to it and so forth.
Right. Doesn't get worse.
Now here's the interesting thing. So to kind of show the different shades of this, we talked earlier about emotions can make something worse.
Yes.
Make an allergy worse or so forth. Right. Now, so that's emotions in the present.
Yes.
Okay. Now you could say, well, then have them relax, have them do what am I thinking about?
Meditation.
That's what I'm trying to think of. Yeah. Things like that, and give them a medication to keep them calmer and so forth like that. Yeah, that's if it's only an immediate response, like you get up on stage and you get embarrassed or whatever.
Right.
It may not be connected to anything in the past.
Right.
It just you stumble a bit and you feel embarrassed.
Right.
But what we're talking about, and hypnosis could actually help with that too.
Of course.
Right? But we're actually talking about, it's not the present day emotion that's the problem. It's this emotion that gets trapped back in an earlier point in their life.
And becomes compounded over time.
Thank you. And what happens is you get a similar circumstance that attaches to that same emotion. And the amount of emotion gets more and more and more.
Right.
And then eventually causes problems.
Right.
So what we're doing is not trying to fix the present day emotion or even yesterday's. We're trying to go back to the source.
Right.
And really get at what the initial trauma is and the trapped emotion.
Right.
And if you release that, then it unbinds all the other events.
Correct.
know?
That's such a good description. That's what we're attempting to do. That's why we use the process that we use. And again, this is just in terms of working methodology. This is not merely just a question of bringing somebody into a hypnotic state, however deep, and telling them, well, if you just relax enough, it'll go away, everything's going to respond in the way it should respond, that doesn't affect you anymore. That can sometimes work. but it's rarely going to be effective in the sort of cases that we're talking about, and it's not what Dave Ellman and others have done, and it's not what we do. We go back to cause. We use a specific process. Healing hypnosis, here we're healing the allergy or the allergic response by regression to cause. It's a specific process, and if you're looking for help with this, you have to find a hypnosis practitioner, if you want to try these methodologies, that is using that type of methodology if you want to use the processes that we are talking about, because we strongly and firmly believe that that is the most effective way to get to the cause.
Right.
And if it's going to happen, you're not going to need usually a whole load of sessions to do that. Again, some people are suffering from extremely severe environmental allergies, which are going to require multiple sessions and maybe a long period of work. Some things are just harder to get to than others. But it's a process, it has a goal, and one of the wonderful things about it is you can see results so fast. They're so measurable.
Right.
It's not a question of just feeling better about things. Just like the little boy with the eggs, you don't respond to things in certain ways.
Right.
So,
right. And and to kind of restate it, because we say this every time, because people might think, well, you're going to stimulate that emotion, and then I'm going to go back to an initial trauma, and I'm going to be re-traumatized,
right,
and so forth. And the fact is, you never are re-traumatized.
That doesn't occur, no.
And we've seen that with cases of even sexual abuse and things like this,
Yeah.
is that the problem is the emotion at the initial event. And it just isn't traumatic. And I know myself, and you yourself have done self-hypnosis or had somebody work as a hypnotist with you and gone to some pretty significant events,
Yes.
and you're not re-traumatized.
Yeah. So this is a, and we're going to, it's funny, as we opened up and began to talk about this topic, we realised that not only is this a big and important topic, but it touches on a lot of the various work that we do. And I don't think we're completely through it. So it may be that we're going to talk a little bit more about it as well in the next show too.
Right.
We'll talk about some other cases, both of our cases, other people's cases, other approaches, what they've observed from times in the past. But the essential message of this show that we want everybody to get is that hypnosis can definitely be effective with all manner of allergies, and it's definitely worth trying if you're a person who's suffering from those, or somebody who is.
Right, yep. Because why suffer if there's a method? I myself have had allergies, and I've done a lot before coming to hypnosis to try to make them lighter and this and that, and it's helped a lot.
Yeah.
But I actually wish I knew about this before.
Right.
So
that's the first part. We're going to pick up the topic again, as we will with other topics, and we thank you very much for watching this edition of Hypnosis Helps. We invite you to contact us if you have further questions, and hope